All right, give me 1 second. Let me get logged in on my computer. Hmm. Hmm.
I can't hear.
Oh, yeah, because I'm muted. Sorry. All right. So the first part of our class today, we're going to go over a lecture. So you're going to be taking notes. I'll give you a title page to load first. Um, then we'll take those notes. We'll quickly check on our simulator to make sure that we have our software and we'll get it downloaded because you will need that for your assignments this upcoming week. And then the last part of class will be more interactive on your part. So I will place you in a breakout room. And the case studies that we had assigned this week, you're going to work with a partner on a case study. Once you're done, we'll give you a few minutes, maybe 15, 20 minutes, maybe, to go over your case study. And then we will rejoin the main forum, and you and your partner will present your case study. All right, so the first thing, and I got to make your ICA available, it will be ICA number 3. You will find it in module 4. This is your title page. It is critical thinking. All right, and this is all handwritten notes. Critical thinking 010226 804. All right, that is your title page. Do I need to repeat that? All right, so in a minute, once I open that up, I will have you load that title page. When we go on break, I need for you to load the notes that we take over this PowerPoint. And then the final thing that you will do at the end of class is you will load your case study and what you and your partner came up with. So it'll be your case study or group number or group name, case study name, and then what you all discussed and presented to the group. So when we do come back to the group forum, as you all are presenting your case studies, I don't need for you to take notes on everyone else's case study, but I do need for you to load what you and your partner discussed as the third piece to the ICA.
Can you
All
repeat that number? I'm sorry.
right. 0102 26804.
Thank you.
Mm-hmm. Let me get out of here real quick so I can go to your class. All right, and this is going to be in module 4. You may need to refresh, and it's going to be ICA number 3. So module 4, ICA number 3, go ahead and load your title page for me. And then once you're done with that, type your name in the chat. All right, everyone get that loaded?
No, yeah, I'm still working on mine. I was having technical difficulties.
Okay. Well, you can just keep working in the background to get that loaded. And then we'll just go ahead and get started because we have a few objectives first before we kind of get to the note-taking slides. All right, so again, this chapter was on critical thinking and problem-solving skills. So in X-ray itself, this is something that is going to be expected of you. Also, I'll say in real life and also in other medical professions as well. So critical thinking in general, it's kind of like the art of reflecting on something, evaluating it through a thought process, even though we don't think of it as the steps that it's giving us per the book. It is a thought process. And the reason why we go through this thought process is we want to be able to come up with a decision. And of course, if that decision doesn't work, we're going to go back through that process to improve upon, of course, for us in imaging, a better image for the patient, of course, for their diagnosis. So it's required of us or necessary of us to think of all of our patients as individuals. All right. Each patient is going to bring us a new challenge in some cases. One case, even though this is going to be the same chest, the next chest that comes in, it might be a little bit more challenging, or maybe the patient category might be different. Maybe this chest is an infant chest, and this chest is, I'll say an adolescent or adult, or maybe even a geriatric. So we have to think of each patient, regardless of the procedure, as an individual. No two procedures or treatments that we go through are going to be potentially the same. All right, so with that in mind, each patient being thought of as an individual, we have to care for them as an individual, and sometimes it may require us to be a little bit more creative than we initially thought we needed to be. We have to be able to think outside the box, and that's going to be expected of you as an imaging professional once you definitely once you're employed, but as a student, once you've been on site for, a certain amount of time, they're going to expect you to be able to think outside of the box as well. So, in terms of thinking of those patients as individuals, again, they're going to present differently, whether it be a pathologic condition that they have within their body, or maybe it is a presentation in general, meaning the doctor is ordering, let's say, a forearm and an elbow. But when the patient comes in, their forearm and elbow, may be slightly detached. So that's going to, one, have us, take a step back, but we still have to be able to deliver that care for the patient based on what the doctor is ordering, because maybe those images are going to be needed for some type of reconstruction in the OR. So, again, think of the patients individually, think of the situations individually. As you hone your skills, you have to be able to think quickly. And whatever decision you make, we still, at the end of the day, we have to have an exam or image that's going to be useful for that patient's diagnosis. So that's one of the things that you're going to start honing as you're in clinic. There's also things that you may encounter that may require you to think outside the box. Maybe you have an equipment malfunction, but they're still going to want that image from you. So again, if there's no additional equipment, your options are typically going to be, okay, we have to shut down and send the patient out, or maybe there is something that you can do with the equipment that you have as a workaround. In terms of maybe using if the light went out, maybe you just use the laser light, and knowing how to position, you can still get the image. It will just be a matter of, okay, I can't clearly see my collimation, but maybe I can get some sort of image so that I can, based on the dial numbers, to get this image for the patient, especially if it's like an emergent type thing. So again, all of that's going to be required. As you transition to different places, maybe equipment will be different in terms of how, I'll say, how advanced it is, or whether it's ceiling mounted or rail mounted on the floor, or whether it's a portable. So that may require you to have some sort of critical thinking. And then sometimes it's something as simple as your patient doesn't speak the same language as you, or maybe their culture doesn't allow them to speak freely to you. Maybe you're a male and it's a female, and she's not allowed to speak with other males. So that may be a challenge. So there's going to be things that are going to require you to, again, think of that patient as a unique individual, think outside of the box. And sometimes it may require you to bring in someone else to assist you or to even take over. So if we're talking about the female patient that can't speak with males, etc. So again, this chapter is based on critical thinking. All right, these are our objectives. Think we have a total of 8. So define critical thinking and problem solving. And as we're going through these slides, some of them will repetitive slides, saying the same thing over and over. Discuss the importance of critical thinking and problem solving in imaging. We kind of discussed that a little bit. Describe the role of critical thinking in clinical in terms of ethics and also in terms of your decision making on the job when we're talking about technical decision making. Use the steps involved in problem solving. Your book listed some steps for us. Even though we solve problems every day, we don't normally think of it as steps, but there are actual steps. We just don't, and we're doing them, we just don't see them listed out. Apply teamwork and self-reflection in critical thinking and problem solving, of course, if necessary, if you're working on a team. Analyze and determine the appropriate actions for situations that require critical thinking, something that you did for your homework, and also something that we will do in your group work today. You looked at some cases, you found out or determined what the problem was. You listed some possible solutions. You chose one, enacted it. The one thing that your book doesn't list as a step is once you do take action, usually there is a review of what the results of that action were. And if the results aren't good in imaging, we would do a repeat. Let's see. Identify professional situations that use critical thinking and problem solving skills. And last but not least, develop critical thinking and problem solving skills as a technologist. This will probably take many years to perfect, and we learn something new probably every day. Because our patients are going to be unique. Technology is changing, so this is something that we will continue to improve from day one until you leave the profession of imaging. But your employers will expect you to be able to solve these problems. Like if they have to solve them for you, then they may take a step back and say, okay, this this person is not a good fit for our organization. So those are the objectives. All right, so this is the first thing that your book talked about, critical thinking in general, just giving you a general overview of what it involves. And this is an issue that employers say that our newly graduated students that they hire, they struggle with. And again, it's because this is something that's developed. It's not something that we know. It's something that's developed by working with patients that present in different ways over and over again. And of course, learning from the patients over time. So in any case, critical thinking involves sound professional judgment. Of course, when we're making these decisions, we will ensure that they are ethical solutions. It does require not only your base professional knowledge as you're going through school and you're learning the different procedures and how to position for them and what the images should look like, but it's also going to be based on your experience. Of course, as you continue to see different types of patients, this is something that you'll throw in your toolbox for later. If you encounter it again, you'll have something to reflect back on and, of course, proceed with probably faster than you did the first time. All right, the nature of imaging itself is going to require critical thinking again because no two patients are going to be the same. They may be similar, but they're not going to be the same. And of course, last but not least, these are traits that your employer will expect. If they hire you, they are expecting that regardless of what presents, you're going to be able to think your way through and get an image for that patient that's going to be useful for their diagnosis. So again, it's something that newer graduates, even those that have been in clinic 2 years, they struggle with because sometimes there is a lot of hand-holding of students throughout those 2 years, depending on what type of sites you go to. And for us in this environment, it's going to be even probably more highlighted because in our current state, you only have one clinical rotation, which is 10 weeks. So we're talking about being able to do all of these exams proficiently, being checked off, and then being employed and being able to operate with no supervision, right? We're not going to have indirect or direct. You're going to be the tech. You're going to be making those decisions. So sometimes our newer graduates do struggle with these skills. All right, critical thinking in your patient. Again, each patient is going to be unique. Although you might have 10 chests lined up on the board, we have to think of each patient as an individual. Some patients, even though our chests are typically standing, maybe they're not able to stand, and we have to do it laying down, sitting, or decubitus. We might have an infant versus, your adolescent or adult or geriatric, and that's going to require a different approach. We may have a pediatric patient, not an infant, needing a small cassette and laying down on the table, but a pediatric patient to where we can't like use the AC. So again, each patient is going to come with their own unique experience. Now, with some of those experiences, again, depending on the presentation, it's going to require you to be creative, and it's going to require you to adapt to whatever the patient's condition is. And then after it's said and done, as you're going through the years and months and days of patients that you're seeing back to back, critical thinking does require us to reflect back, especially on something that we found probably more difficult, and that will give us the ability to improve in the future. So this is something that's going to be expected of you. All right, critical thinking in learning itself. So we're giving you the book knowledge, and that's going to help or assist, but it's not always going to help because your patients may potentially present different ways, not the book expected way, or not the way that you practice in the lab with your peer that's able to get into all of these positions easily. So especially again, if you don't have that book perfect patient, you have to be able to maneuver and adapt to the patient that presents in front of you. All right, you have to be able to communicate with the different types of patients as well, whether they don't speak your language, whether they're a child, whether they're, in pain. You have to be able to communicate, adapt, and still get that image. So again, it's more than just you recalling what you learned from the book. It's you putting what you learned from the book in action. And that happens typically via role play, via lab simulations, not necessarily the simulations that you have. Most traditional schools are going to have a lab where you're practicing actually positioning your peers, and you will be positioned by your peers, and you can see how difficult some of these positions are from patients. So you can recollect or recall that when you're working with patients to know that, okay, I don't have all day to keep this patient in this position, especially when they're in pain. Case studies is what you had for homework, and what we'll be doing in class, and also, your best judgment based on the situation that presents for you from the patient. All right, so again, they are taught, but again, it's something that's going to come with experience over time. When you're thinking through a situation or using those critical thinking skills, again, it involves you analyzing the problem. You're going to come up with some solutions. You're going to actually apply the best one that you feel fits that particular patient or case. And then, of course, at the end of the day, once you finish with the patient, you're going to evaluate whatever that solution yielded. And if it wasn't a good solution in imaging, that means that we're going to potentially repeat it. Now, if after we repeat, we still don't get what we call a diagnostic image, especially if you don't have someone that's working with you as a team member that you can call in to assist. You may have to go to that provider or radiologist and say, hey, this is the best that I can get based on the patient's presentation. Of course, we're going to document at that point. All right, these are the steps that our book gave us. First, we're going to identify the problem. So figure out what the problem is for that patient. We are going to analyze that problem and come up with some possible solutions. And then from those possible solutions, we're going to pick the best one and put it into practice. And once we put it into practice, even though it is not listed there, once we implement it, we do have to come back and review, especially in imaging, we're going to come back and review what it yielded. Because if it didn't yield an image that's diagnostic in nature or useful for the patient, that means we got to go back to step one and potentially pick a different course of action. So if that means we need to reposition the patient and shoot it again to see what we get, or if we need an additional image because that one didn't yield what we needed, then that's what we would do in imaging. All right, critical thinking itself, when we're talking about imaging itself, it does happen in a few places. So the first place we're gonna do it is kind of in the classroom. So basically when you did with your homework, and what we will do in the breakout rooms in this session today, you're gonna work in groups, work through a case study, and then you're gonna pick a solution and of course put it into practice, but we don't necessarily get to see the fruits of our labor. In the lab, you will also do this. Traditionally, you would have a live lab where you would person, you would work in a group, you would position a patient, get your instructor's feedback on what you did. Vice versa, someone might position you and they would get their feedback. But typically in the lab setting, unless you have a phantom, you don't get to actually see the fruit, like the actual image, because we're not actually imaging each other. You need a doctor's order to do that. Plus, it wouldn't be safe us just taking images of each other every day. Now, your simulator does provide you the fruit, but on the opposite side, you don't get the in-person hands-on. But you do get to see that based on how I position this patient and how I centered and whether or not I detented, this is the image I get. And then you get to compare your image to the book image to say, okay, every piece of anatomy that was supposed to be there is present. I didn't clip anything. I'm going to be good to send this to the radiologist. Or you look at your image and say, or your instructor grades you, of course, and you say, okay, this doesn't look like the image that was in the book. What did I potentially do wrong? So it does allow you to evaluate it. And then last but not least, students get to critically think or perfect those skills or hone those skills in the actual clinical environment. So this is where you are gonna get your real world experience. First, typically you're gonna watch your techs for a little while to see how they do it. Then you're going to participate or assist the tech. Then you're going to get to the point where not only you're ready, but they trust you to do it on your own, but with direct supervision. And then last but not least, once you do successfully comp, they're going to feel more comfortable with you and they're going to allow you to do your own exams with indirect supervision. They still have to approve all of the images. They still have to be in the department, but they may not hover over you as much once you show or prove that time and time again you can do a chest x-ray. They're going to trust you to do it, but they still have to check off on your images before they're sent off and before the patient leaves. So again, this is where you are going to learn. So in terms of the professional standards, your employer and also your clinical site, they are going to expect you to be developing these. Or if we're talking about the employer, they're going to expect you to figure it out. All right. If they have to hold your hand, every time you get a difficult patient, they may decide that you're not necessarily the best fit for their environment. So again, they don't expect you to know it right away because a new graduate would struggle with some of this, but they do expect you to be able to show that you're growing and you're able to figure things out. All right, so in the clinical setting, again, this is where, of course, we're going to always be ethical, but this is where you're going to get that real world hands-on experience. This is where you're going to learn, put things into practice, and of course, improve over time. I won't say necessarily in the beginning it will require you to be proficient at critical thinking, but we do expect you to be able to If you've seen this time and time again, we don't expect to hold your hand every day. So we need to see that you are able to eventually function with that indirect supervision. Of course, as your employer, you have to be able to function with no supervision. You're the person in charge. You are the one that's taking the images. You're the one that's going to make the ultimate decision on whether or not this image is going to be diagnostic for the patient's diagnosis. Sometimes, again, if there is another person available to assist you, it will require you to work on a team. And that's going to require you to work well with others. So teamwork is another thing that comes into play sometimes when we need to critically think through things. So let's say there's a team of techs and there's a free tech, and I've shot this a couple times. I'm not able to get it. I might be able to lean on my peer to kind of help me out. Like, hey, can you help with this really quick? I've done it X amount of time. And depending on who that peer is, especially if they've been in the field for, a long time, they'll be able to assist you with that. So even if it's a nurse. So one of your case studies, I think it said that maybe the patient was dizzy or they didn't quite know if they would be able to stand for the exam. That might require you to say, okay, I'm probably not going to be able to do this in the way that we typically would. So let me figure out another way to do it, an alternate way to do it, and then maybe get some assistance as well. All right. Again, every patient is potentially going to be unique, and whatever they present with, it may require you to adapt to whatever situation. Again, if they've ordered something for a limb that's usually attached, the patient presents and is detached, then you need to be able to figure it out. If it's an exam that's usually performed on a patient standing conscious, or maybe laying down conscious and they're able to assist you with the positioning, but the patient that you get is unconscious, then you have to figure out, okay, how am I going to get these? Am I going to use some type of immobilization device? Is there someone here that can help? Does it need to be delayed? And that just depends on how critical that patient is. So again, you still have to get the exam done. All right, it requires you to have a complete understanding of the principles of the profession and also the practice standards. Now, again, as a student and sometimes as I'll say a new tech, again, something that you are developing, but you at least need to understand what it is that you need to do. So the last bullet point that's in the block is important to learn to work on a team, basically. You as a tech, you're going to be working with doctors, you're going to be working with nurses, other healthcare professionals, such as maybe you're working with the surgical team, like the surgical techs, they can help out and assist. They've seen some things, especially if you're new, you're in the OR. Sometimes your surgical techs can help you as well because they've done it time and time again with the C-arm, so they can help. Or maybe you have to work with a physicist. If you're working with a physicist, that's typically sometimes on some type of maintenance, or some type of, maybe you're working with them to come up with the technique chart. You're working with phantoms, or if it's let's say your radiation therapy, you might be working with a health physicist on your patient's cases as well. So again, it sometimes requires you to work on a team. And if you're working on a team, you have to be able to work well with others. All right, these are the steps again. Identify your problem, investigate the problem, come up with some solutions, pick the best solution, put it into action. And the bullet point that I think is important that's not there is, once you put it into action, you do have to evaluate what it yields. And in imaging, if it didn't yield a good result, then you have to be ready to do it again. Of course, keeping ethics in mind, you want to keep ALORA in mind. We want to do it right the first time, but sometimes we don't get it on the first time. So we have to think about repeats or additional views or alternate projections that could be used for that patient. So overall, you have to be able to adapt and to whatever situation presents. All right, I think this may be our last slide before we go into our case studies, but in any case, whatever case or whatever patient presents, we're always going to operate with ethics. We don't want to do anything that's unethical that's going to cause a potential lawsuit, potential harm to the patient, or potential loss of your right to operate in the field. So as a student, that means you can be dismissed from a program and you're not able to sit for your boards to gain that licensure. As a professional, you can lose your job, lose your licensure, and of course be sued as well. So don't think for a moment that the hospital is going to take the complete fall, some or facility that you work for is going to take the complete fall. Sometimes it's going to roll downhill, and that might be on you, especially if you made the wrong decision. Requires complete technical competency as a student, something you're still gaining. But once you become a tech, they're going to expect you to be technically competent, meaning know your procedures. If you don't know the procedures, be able to do your research, go to the book and figure it out. Because depending on the site, there's different types of settings, and what you see in ortho is not necessarily what you're going to learn and what you see in the book. They have their own set of special type of exams that you're not going to necessarily be able to see from the book. So you have to be able to figure out what those are. And also requires you understanding that no two patients may be the same, even though it might be the same exam ordered. The patients that present based on age, based on sometimes gender, based on whatever their pathologic condition is, they all might be very unique and require you to use a little bit of critical thinking to get the job done. All right, now the time is all right, 8:37. So really quickly, you should have already loaded your title page. I need you to go ahead and load these critical thinking notes for me. And once you load those critical thinking notes, we're going to quickly figure out if all of you have access to the download from virtual medical coaching that we briefly looked over last week. Sheila, let me look at this, but files, these files are going to be loaded to the ICA, but I don't know what you loaded, so I'm just going to check real quick. Yes. So that title page, as well as your overall notes, these will be loaded just like you load your homework, but you're going to load it to the ICA slot in module 4, ICA 3, module 4. All right,
Thank
so
you.
far we have 2 documents. We have this title page that you loaded, and then we have the notes that we just took. So
Okay.
for you, you can just go ahead and load that section of notes.
Okay. Thank you.
Mm-hmm. All right, and remember we have to have a video shared. All right, so when you're done with that, I would like for you to go to www.virtualmedicalcoaching.com. I'll give you a few minutes. I just want to type some comments in the in the ICA. All right, so this doesn't require you to respond to it. The only thing that I'm just typing in for those that submitted this stuff, and this is just for me, a note in your grade book for this submission that says present for class. That's all. So you don't have to respond.
Professor, please, what is the website you just mentioned?
www.virtualmedicalcoaching.com. Now, some of you may have successfully retrieved your password last week. If not, at the top of the form, at the top of the website where it says log into portal, instead of typing in your username and password, you are going to go to forgot password, and the password that you're going to use to try and reset it, the username is going to be or email is going to be your school email. All right, so present right now, that I have typed a note in for is Amanada, Ashley, Rodolfo, Gloria, Cheyenne, Zachary, Bria, and Cora. All right, did I miss anyone?
You missed me, Shalia Harrison.
Uh, okay. I don't have any. Oh, okay, I'm gonna type a note. So again, make sure you get those documents into the actual
ICA.
but I will type a note in your chart. All right, anybody else besides Shalia that I missed because I'm typing these notes to myself.
I think I got mine. You didn't answer my name.
What's your name?
Jaina.
Jaina. Let me look. Um, I'll just put a note to myself. I don't see it populating yet.
Hmm.
I might need to refresh though, so I'll just put a note in there. All right, anyone else that I missed that's present?
Me, Colby.
Colby.
I'm here too, Micaiah.
Colby. Okay. Here. Okay, Colby. And All right, so if you are present, then you should see a note in your ICA that says you were present for class. Just check it, because if it says absent, then it's because I don't see anything yet. Makaya, I don't think I have yours yet. Shalea, I don't have yours yet. Jaina, I don't have yours yet either, so I'm not sure.
I'm sending mine now.
I'm not sure exactly. It's going to be module 4, ICA number 3. Just like you submit your homework, you'll just submit at this point, just submit the one form, your notes, because we did start with just the title page that just tells me that you were here at the beginning. Notes say you made it to the middle, and then the last part after you work in your breakout groups will tell me that you were here until the end of class. All right, so now we are on virtual medical coaching. All right, last week we kind of got stopped because your downloads weren't there. So once you log in, is everyone able to log in, first of all? When you log in, let me share my screen.
It's a virtual medical coaching or .com?
Virtualmedicalcoaching.com.
Coaching.
All right, I'm going to share my screen. All right, so this is the main web page. Now, once we download the software, it will give you an app that you can launch through. So say log in via browser or app, but this is the base page. You can always get to your simulator through this page. At the top, again, where you see towards the right side where it says book demo, we're gonna log in to the member portal. And this will be, if you did it last week, you probably reset your password, or maybe you got to your email before the thing expired. If you did not get to it or didn't see it, or it was spam, just go to forgot password and go through the steps to reset it. But the email will be your school email address. All right, so we're going to go ahead and sign in. All right, and hopefully you see this. It comes up to a simulations page with the picture on the right that says radiography and a guy in the room. On the left, we see simulations, reports, support, and download. We are going to click download. And hopefully today you will see that there's 2 options for download. One's for Windows, one's Mac. So if you have a Mac, download the Mac one. If you have any other type of computer besides Mac, you will download the Windows version. Once it downloads, and I'll give you all a few minutes for it to download, click on the download and go through the setup process. We're setting it up for 2D. All right, anything on the computer is 2D. The VR portion, you will interact with that once we send you the Oculus, but the VR portion is the reason why we set up the account last week with the Meta. All right, because you'll need that to use the VR. All right, so go ahead and download your simulation and get it installed, and we'll show you what should be showing. And this is something that you need for this week's discussion and also probably the homework, maybe, but if not, worst case scenario for discussion, I think. If not this week, if not this upcoming week, it's the next week. All right, I'll give you a few minutes to get
Professor,
that. Yes.
yeah, you said so to I forgot what you said because you was fast. So you said when you log in, when you are on the website, what do you do next?
Okay, I'm gonna go to the website. Can you see my website page?
Yes, I see.
All right, at the very top, go to
Mm-hmm.
the right side of the page. You'll see a blue box that says book demo.
Mm-hmm. Okay.
Right beside that box, you see login to member portal. You are gonna click on login. Now, this part, when you log in, it's going to ask you for your email address and password. If you were successful last week, you already have that. If you were not successful last week, hit forgot password. And it's not showing for me because I'm logged in. Let me log out.
So you said put the school email to the sign in.
Yes, so it depends on whether or not you were successful last week. Do you recall getting in last week?
Yeah, that's what I was asking you. Remember, I emailed you. This is what I was talking about. So I didn't get no code.
No, last week though, we were working on two different things. We were working on meta accounts that sent you a code or a
Yeah,
verification email, and we were
yeah,
working on this. So they're separate.
yeah. I know. The mid code or what? I got that one, but this one I couldn't. I mean, it was too many things. So I didn't set this.
Okay, so hit forgot password.
Well, I didn't even set the account.
No, it's already set. So hit forgot password.
Yeah. Okay. I
And
have.
right here, type in your school email address.
Okay.
Can I ask a question really quickly?
Mhm.
So I downloaded the Mac version of it, and when I log in through my school email on the actual app, it just takes you to a page where it says like practice or assessment.
Yeah, that's
That's
what
what
we
it's
want.
supposed to look like? Okay.
Yeah.
Thank you.
We're always going to work through the practice part though, until your instructor says that they need for you to do assessment. The difference between the two is practice is going to give you like some cues, whereas assessment is going to expect you like to know what the technique is and all of that good stuff. So you're going to operate through practice. All right, Aminata, are you good to go?
Yeah, I got my email in. So the password now.
All right, so now go to your email and they would have sent you some instructions on how to create that new password.
Okay, let me
There
check.
were a few of you who had to do this last week, correct? Okay. All right. So you're waiting on the email for them to send you the password. All right. So I'm going to sign in. And mine is not coming up the way that Gloria just said. I'm guessing because now she's operating from the app. So there is like an icon that will be somewhere on your computer that looks like a little squiggly H. That is the app. But when you hit practice or assessments, practice, you should see simulations. If your software downloaded, you're gonna hit the simulations in the radiography picture, and then you should get this menu. All right. Are we this far?
No, I didn't receive no email. Yeah.
Maybe look in your spam. Your
You
junk
mean
mail.
the school email, right?
Yes, but there should be a junk mail spam portion of it as well. Yes, Kobe? I think you're on mute. You're on mute. All right. Besides
Sorry.
Emanata,
It just
oh, go ahead.
it won't let me like the app like it disables everything else on my computer. So I'm just gonna follow along with what you're doing. But I'm
Yes.
able to
So
get into the app. It just doesn't.
when you do the app, yes, it's probably gonna make you not be able to do anything else. But if you do it through the website, so as you guys are working in your groups eventually with this, you want to try to do it through the website versus
Gotcha.
the
Okay.
app because the app will
Okay.
take over. All right. So again, when you click on one of these, I'm just going to click on torso as you guys are practicing. Now it should bring you to the projection. So that's going to be your PA and lateral. We're always with the computer. We're going to launch the 2D simulation. The VR one is for when you get your Oculus. All right, and then it is going to launch you into a room from there, and I'll share my screen of the room that it launched me into for that particular procedure. This is what you want to be able to do. If you didn't download the software properly, then when you hit simulations, just like last week, it'll say no simulations available or something like that. So besides Amanada, is everyone able to get to this point?
Yes, ma'am.
I'm having trouble finding
I'm
it.
having trouble as well.
All right.
I didn't see no email.
Who is I?
Shalia.
Cheyenne.
I'm working.
Cheyenne.
Shalia and Shy.
I'm making mine because I haven't been here for about 2 or 3 weeks due to sickness and a crash, Micaiah.
Okay. You're not making it though. This is something that was
Well,
already
yes,
sent to
resetting the
you.
password. My apologies.
Oh, okay. So if you weren't here last week, hit forgot and look for something in your spam, or you can find the actual initial email that came from virtual medical coaching that might be sitting in your spam, your school
Mhm.
email. It says something like 24 hours. But this is why you're going to have to go to the forgot piece.
Yes, and I did
Um,
receive the email and it did let me in, so I'm good now.
okay, so make sure you download the software for your operating system. Cheyenne,
Yes.
on.
So
Yeah.
I'm seeing the torso. You said go to torso.
Yep, hit torso. There's two views there. It doesn't matter which one you pick. Was it PA and lateral? Or no, maybe it says chest, abdomen, etc.
Mhm. Yeah, say
You can
abdomen.
pick any of them. We just want to make sure the simulator is working. So pick abdomen, whichever view you want to choose or projection you want to choose, just make sure you're using 2D.
Okay, 2D.
And then that should launch you into your x-ray room.
Mm.
Just out of curiosity, if we have like a VR, would it not like connect to this where we could do it on our own, or would it have to be on
You could, but you're gonna be looking for also an email from Virtual Medical Coaching that says something invited you to an app.
Mhm.
Do you see that?
Let me check really quick.
Okay, it works for me. Thank you.
Okay.
Yeah.
Shalia, what part are we on for you?
I'm looking through my junk mail. I just submitted it again, and I'm hoping that it'll come up in my student email. So I'm looking through that now.
Okay.
The password.
All right. And Zachary, so you have a Chromebook? Yeah, I don't
Yes, I do.
know if you're gonna be able to do it with that Chromebook. Do you have a family member with an older operating system or a Mac that you can borrow when
Yes,
you
I
need
do.
to? Okay. So same thing, just figure out which operating system you need, download that software, and you're gonna have to. I don't think it likes Chromebooks.
Okay, I'll get one.
So what error did you get when you tried to download it?
Hold on, I'll tell you. It just popped up here. It says this file is designed for a PC using Windows software.
Oh, gotcha.
This
Okay.
is not compatible with your device.
Gotcha. So yeah, it doesn't like Chromebooks. So pray that you can get access to a computer and not have to spend money on one. But when we do send the Oculus, you will have your own Oculus. If you have an Oculus already, there is an app that you have to be invited to.
Yeah,
Okay.
I didn't see the email about the app yet.
Okay. So I will email them. I wasn't really concerned about the app yet, just because we don't have the Oculus yet. But there is an app that you can launch. I don't know if you can Google virtual medical coaching in the app. Let me see. I don't have my Oculus, so I can't think of what the app name is. I would have to search through my emails to figure out what the app is, but eventually virtual medical coaching would send you an invite to the app, and that's why we set up those Meta accounts with your username as the school one. All right, but I'll figure out what the app is.
Well, Professor, I tried to check all my junk and I didn't see anything.
All right, so you may need to, Aminata and Sheila. Remember last week when we emailed, let me get the email address. All right, Miss Zach, we know your issue. So for the discussion, there is a portion on there. I think it might be in the announcements. It says something like, hey, by Wednesday, respond to at least this portion of the discussion. Make sure you have that part done by Wednesday, and then hopefully, I think it's this week. If it's not this week, it's next week. You can respond to the second part as soon as you get your stuff downloaded. So
Professor,
yes.
I was absent last week due to having the flu, so I wasn't able to do what you all did. So I'm still trying my best to get into this app.
So you're gonna have to watch the lecture from last week. It should be in the announcements, I believe. I think I'm fairly certain it is. You're gonna have to watch that and kind of try to follow the steps. Even though you weren't present, I don't know. Did you get an attendance exception? Did you request one of those?
I did and spoke to my advisor today. So yes,
Was it approved?
she said it was going to be. So I'm not sure if she got in touch with you or not yet. But
I haven't heard. Well, I haven't checked my email today, so let me not say that. I haven't checked my email thoroughly. Let me see. Copy. All right, so the email address that you all, Shalea and Aminata, you need to email. Ready?
Say again?
You need to email. Ready?
yes,
Yeah.
support@virtualmedicalcoaching.com. Just let them know that you are not able to access your account. You tried the reset password and it's not working for you.
Support virtual
Support at,
support that.
let me type it in the chat. All right, the email address is in there. Now, before we go on break, when we come back, I am gonna put you in a room with one of your peers. You will at that time need to have your book open in the background. I think it's page 36, but it's chapter 4, and you will be assigned a case to work through with your peer. And then we will come back to the main forum, and you and your peer will present your case to the group. The last thing you will upload to your ICA will be what you and your team member came up with for your case, right? And the cases will correspond with the room. So if you are in room 1, you will have case 1. That's for your group. If you're in room 2, you will have case 2, and so on, so on. All right. So again, when you come back from the break, we're going to take 10 minutes. When you come back from the break, make sure you have your book open so that you all can see your case, and you're going to be ready to go directly into your room with your peer. So back at 9:17. All right, so I think everyone is back. We have 14 students. Let's see. One second. All right, does everyone have their book open already? If not, make sure you have your book open so that you can see your case studies. Uh, Breakout rooms.
Which page? Under week 4?
It's chapter 4. I think it's like page 35
Yeah,
or 36.
35.
35. Okay.
Yeah.
35 is where you'll see the cases listed. The same cases that you viewed for homework, but you're going to be assigned one with a team member. All right, and we're going to I need at least 7 rooms. All right, and you're going to work with your peer. When we do come out of these breakout rooms, you will present the case to the group. Everyone has to participate. So like Kobe can't do it all for her group. Everyone has to present a piece. And then the last thing you will upload is your case with your peer group member names. But of course, you're doing your own writing, what the case was, and then what you guys came up with or discussed during that breakout room session. So everybody's clear? All right, so I'm going to assign and open the breakout rooms. Once they pop up, you just go to your breakout room, confer with your peer. Either the rooms will close altogether or I'll broadcast a message to you to come back so that you can present your cases, okay? All right, here we go. All right, everyone go to your room. Aminata, you have to find where your breakout room popped up at, and you have to go to join that room.
Where?
It should have popped up somewhere on your screen that your breakout room was available. All right, can everybody hear me? Okay, so we'll go ahead and get started with the individual groups. Everyone's not back yet. Let me see. Let me just close all the rooms. All right, so since room 3, no. Is group 1 Ashley and Gloria here?
Yes, ma'am.
Okay. All right, so we'll just go ahead while we're waiting on everyone to get back. Go ahead and present your case study 1 to the group.
Okay. So me and Ashley had case 1. And essentially, what the problem is that we need to escort a patient from the waiting room and give her instructions for the procedure, which include removing all clothing from the waist up, any metallic objects from the chest and abdomen area. And then we need to take the patient to the examination room and place her in the correct positioning for the procedure. The problem would be that neither of us speak the same language in great amounts. So, what we would need to investigate first would be the hospital's ability to have a translator. And if the hospital did not have a translator, we would then need to investigate if we had any visual aids or anything else that we could use to communicate with the patient. And then we would move into figuring out what our solutions would be.
Okay.
So the best possible solution that we could formulate would be to maybe do visual demonstration, do our best to find a translator. I know not all hospitals have them. Maybe see if our phones could have a translator. See if anybody else in the hospital could understand even a little bit. It did state that the patient understands minimal English, so maybe figure out what English that she could understand from us. And then the best solution would, obviously be get a translator, keep the translator in the room with us to demonstrate, to make sure there's no miscommunication more than what there already is.
Okay. So obviously we're not looking for like a right or wrong answer. So your choices were definitely good. Some students have also said in the past, like depending on what you're trying to get the patient to do, for instance, you can demonstrate for them what you need them to do. And then also, I think a lot of facilities are going to some translator apps, and of course, phones potentially to help assist for those that don't have a translator readily available. All right, good job. So group 2,
Hello. So we had case number 2, which was considered Bob, the seasoned technologist that was being a little too aggressive with the patient, the elder patient. This guy could not hear well, and Bob didn't really take that into consideration. We felt as though the problem was that this was considered elder abuse just for the sole reason that the patient literally said that, "Why are you hurting me like this?" So he verbally stated that he was being hurt. So that is the problem. To further investigate this problem, would we thought that he did break like one of the number 1 rules, which is patient safety, which is one of the main code of ethics that he should be following, especially as a seasoned technologist. Yeah. And yeah, anything else?
I can do the.
Okay.
No, I think that's everything we had on those. And then for the solutions, we had obviously step in and stop the situation. The patient was very clearly confused and distraught and definitely in pain. Also thought you could separate the patient from the tech and allow the tech time to cool down. And and then bring it to the tech's attention on the situation that just happened, and then obviously report it to the supervisor to avoid future occurrences. And then we said that the best solution would be obviously immediately stopping the situation and then reporting to the supervisor or the higher ups.
Okay. All right, group 3.
Group 3. Me and Zach had group 3. The scenarios that we had a patient come in from the emergency room, experiencing abdominal pain. The issue is that he wants to help, but he's probably not able to due to we don't know what medications were given to him at the emergency room. If he's forced to stand and he falls due to the medication, we could be liable for it. It's legal trouble. We don't want to further injure the patient. So we came up with 2 sec. You want to read the last 2? I can continue reading it.
Okay. What'd you say again? Do you want me to read?
So for the viable solutions that we came up with.
Okay, so we went to try staining X-ray with help, and then have the patient lie flat on their back. And then we put the best solution is safety first. Would try the staining X-ray first with help, or not able to then have the patient lie on their back. And then that's as far as I got with it as well at the moment. I was working on it, but
And that is it. I don't know if we're getting a response back because I can't hear anything.
Kennedy, she said we can go.
Okay. So, me and Michaela, we had case 4. So, the patient, she was experiencing nausea while being while being fully immobilized by a head and neck mask during an active radiation treatment. So, the patient, she was unable to protect her airways, and if she I'm sorry, she was unable to protect her airways. That was one of the concerns if she vomits, because again she is fixed on a flat on the treatment table, so that would be an immediate emergency due to the high risk of airway obstruction, and also the patient, they can panic, again if us we as the radiation technologists just rush into the room, that can cause them or furthermore damage. And you can go ahead.
Yeah, so we did agree that, like she said, the patient could panic, the potential for radiation exposure. And so we decided that the best course of action would be if we remove the mask immediately, because it did give the option to wait for another radiation therapist. But again, because the patient was completely lying on her back and strapped to that table, our best course will be to go ahead and unstrap her in case she got ill. We would assist the patient into an upright position in case she did potentially get sick. And if the patient stabilized, then we would continue the treatment. If not, then we would just need to reschedule because the possibility of asphyxiation would be too big.
Great. Next group.
Group 5, right? I think. We had a diagnosis. Mr. Green had come into the night shift with a 1-inch. Well, they had said that there was nothing on it, but she had noticed that there was a 1-inch gap, and they were about to discharge her. Possible things that were wrong was a malfunction issue, communication, and the biggest problem was that the radiology tech was a resident that was asleep. First, we need to contact the nurse with the issue that had happened and address it. Let her know what you had seen.
Okay. And so I'll take it over from there. Like she stated before, addressing the nurse about the problem, that she shouldn't have been even considered to be released because the physician, I presume, based on the scenario, has not seen this patient yet. And we're the technician, so we did our part, but the radiology resident was asleep. So the diagnoses weren't probably given, and the patient was not given any medication. And far as the ARRT best code of ethics that we came up with would be professional conduct, upholding professional standards, taking responsibility, and not acting with care is how this whole situation, I guess, derived. And speaking to the nurse at that point, I guess she would convey the information to the physician, and then we would take steps that need to be taken from there.
So we were group 6. There was a woman that was going to undergo a radiation procedure, and we asked if she was pregnant, and she hesitated. So identify the problem would be having to clarify if she's pregnant or not. Undergoing radiation could be harmful to the unborn child if she is pregnant. It's also unethical. So then we would investigate the problem, let her know about the risk, and ask her again to clarify because there was that hesitation at first. And then we could also request a test before going on with the procedure.
Okay, can I add this? So we are not going to move forward because she was hesitating, and she must bring a proof to show that she's not pregnant.
And then I can add as well. So the best thing that we came up with, we just advised her of the guidelines, advised her of patient safety, and how we're not able to administer any treatment or things like that due to her not being sure and us, having a red flag of her not knowing if she's pregnant or not. And just let her know that she can, if she would like to return at a later date. And if possible, she can see her provider to get test results proving she's not pregnant. So we can assess the situation and get her scheduled for that test. We just want to make sure she's okay, and we're upholding ethics as far as careful risk assessment, and we're being informed. We will document the situation that we've asked more than once, as well as her statement of her saying, is it necessary if she is pregnant? Because she made a statement saying, is it necessary for treatment if I am pregnant? So that raised a red flag too, because she's very unsure if she's pregnant or not, or could possibly be pregnant. So we would not move forward with it. She can come back at a later date, and we'll just let her know that, and the radiologist and stuff. So.
And also the patient has the right to ask questions, to know why. Yeah, she has the right to answer, to ask question. So, and we can answer any questions she asks also. With itself.
Right. Last group. Was that the last group, or did we have another group?
I was talking, I forgot I was on mute. I think that was the last group. We were the last group because we were a group of 3. We were group 6.
Okay. Well, that concludes our lecture. Again, remember to make sure that you upload this last document to your ICA. And if you have any questions for me, just give me an email. Aminata and Sheila, make sure you email virtual medical coaching to make sure that you get your codes. Get your account. Email me if you need help with the setup process. And I think, was it Zachary? You gotta work on the computer issue.
Yeah, I got it. I'll work on it.
All right. Well, we'll see you next week.
Thank you.
Hey, can you check and see if you got my things now, if they uploaded? Because I had a problem with it last week too. So I want to make sure that the 3 did. I'm about to upload.
Bye, y'all. Happy New Year.
You too.
Happy New Year, everyone.
Happy New Year.
Yeah.
Happy New Year.
Happy New Year, guys. Take care.
Dana did get it.
You did?
Yes.
Okay. Thank you. Sorry to bother you. Thank you.
You're welcome. You're welcome.
Just to make sure, you said the notes basically is for the beginning, just to say that we were present, the middle, and then the notes from the assignment we just did, right?
Yes.
Okay, perfect. Thank you.
All right. See you next week. All right. Next week. All right. Thanks.
Dr. Dennis. So actually, I have sent some emails to you, and I don't want to annoy you with the emails, but I know it's been the holidays and stuff, so that's probably why I haven't heard back. Um, but this actually involves my assignment from week 3. You couldn't access my Word, and I gave you access to it, and you said that um, you'd update grades that following Monday. Um, but I had some stuff going on. I had some appointments I had to go to, and then I emailed you about that as well. And I haven't heard anything back, but I was just wanting to know if maybe you got around to accessing that Word document because it still shows like a 13 out of 100 on the module.
All right, let me look.
Thank you. It's been stressing me out, but I didn't want to aggravate you with the emails.
Let
I think it was the professional development plan one. I didn't know I had to give access to the Word. I just assumed where it was the school, you'd get it.
thought I graded it. Though. It still won't let me. Is there any way? Let me type it in the chat.
Okay. Yes, when I uploaded it with the link directly from Word, so I probably can download it from my computer and then upload it like a regular file. I just didn't want to mess up anything for it being so long out. But I can go ahead and do that. I kept it saved on there, so I can get it uploaded on there for you. And then I will let you go because it's echoing. But I can do that right now. Okay, thank you.
Right.
Mhm.
Thanks. You can turn on your music. Wait. Yeah.
Our natural world was to be challenged. Live was to be challenged ethically. But in modern society, it's suddenly possible to survive without ever being challenged. You'll still have plenty of food, you'll have a comfortable home, you'll have a good job to show up to, and some people who love you. But if you think of human potential as a big circle, most of us live in a small space in the middle because life rarely challenges us. We have no idea what exists on the edges of our comfort zone. And by not having any idea what it's like out on the edge, we really miss something vital. Enter a concept I learned about called Mesogi. I learned about it from Marcus Elliott, a Harvard-educated doctor who has revolutionized sports science with the work he does with his company called P3. Mesogi is an ancient Japanese myth about a character who goes on an epic, challenging journey through a dangerous landscape and is forever changed by the experience. Elliott began taking on epic physical challenges for the sake of growth in the early 1990s. He then began calling the practice Mesogi as a reference to the old Japanese myth. Elliott's version of Mesogi, a big, epic challenge, acknowledges that growth occurs when we leave our comfort zone and throw ourselves into a challenge. Marcus says there are only 2 rules to Mesogi. Rule 1, make it really hard. We define this by saying you should have a 50-50 shot at finishing whatever your Mesogi task is.
Patrick said, are you here? He'd like to reply. What do you want to say, Patrick?
No, man. We actually just got on the road.
Says, man, we actually just got on the road. Done.
That's good. Hey, even when we take on challenges, we only pick things we're rather sure finish. We need to face the real possibility that we may fail. A coin flip's chance. Rule 2, don't die. This is a tongue-in-cheek way of saying, don't be dumb. Be safe. Marcus has done strange Mesogi challenges, like one day running stairs with the equivalent of the same elevation gain as Mount Everest, or stand-up paddleboarding the Santa Barbara Channel, when him and the group of people he did it with had never stand-up paddleboarded before. And he does these Mesogi challenges, people ranging from accountants to literally Super Bowl MVPs. And what Marcus is trying to do is mimic ancient challenges the natural environment used to show us that are part of our DNA. This shows us that we chronically undersell our potential. When we do something that truly challenges us, we will inevitably hit an edge where we think we're done. But if we keep going, putting one foot in front of the other to cross and recross that perceived edge, despite our minds screaming at us to stop, we can look back and see, hey, I thought my edge was back there, but I'm past it. So I've sold myself short here, which leads to a larger question. What else am I selling myself short on in life? The implications of that are giant. You can take the realizations you had on Mesogi into your everyday life. Things start moving, improving, and you realize you're capable of so much more. I wrote about the concept of Mesogi in my book, The Comfort Crisis. But the thing about the idea is that it can come off as kind of kooky, yet it shouldn't. It turns out that taking on epic challenges like a Mesogi is part of deep human history. And that's what John Booker is here to help us understand. John holds a PhD in myth and depth psychology and is the director of the Joseph Campbell Foundation. He studies what Campbell called the hero's journey. It's a framework for the stories we all know and love, where an ordinary person is called to adventure, faces trials, and ultimately returns transformed. But we're not just talking about mythical heroes. We're talking about you.
The hero's journey is an idea that seems to have been brewing inside the human psyche for a long, long time. And people throughout time began to recognize that there seemed to be some sort of pattern that was emerging when people told stories about individuals that went through processes that involved really difficult things in order to try and achieve something. And at one point in history, different thinkers and storytellers and researchers and philosophers began to put forth ideas about the similarities that they were seeing called the hero's adventure or the hero's quest or the hero's journey. And along comes an individual named Joseph Campbell, who has heard of many of these ideas. And he begins to see connections that people haven't quite put together before. And he actually never uses the term the hero's journey. He uses the hero's quest, the hero's adventure, the hero's but he writes this book in 1949 called The Hero with a Thousand Faces. And the book has a resonance to it that people, even outside of mythology circles and philosophy circles and psychology circles, begin to talk about these ideas. And somehow it catches a fire, and the hero's journey becomes part of our cultural. In its most simple form, the hero's journey is about going on.
Well, but they're an hour behind, so it wasn't.
And then bringing that thing back to your community in order for the betterment of everyone.
What is that thing that people think that for not listening?
This is the question, because there's something inside of us that thirsts, that craves something that we're unable to put language to. And one of my favorite articulations of that comes from Arthurian legends that discuss this idea of a holy, this thing, this cup, this chalice that brings eternal life. But in essence, it's just a metaphor for that longing inside of us. I remember when I was a kid, I heard this U2 song called I Still Haven't Found What I'm Looking For. And there was this deep longing in the song that it sounded painful. It sounded like there was something to this thing that the singer was after that he had trouble putting language to. And I think most of us resonate with that. There's an itch we're trying to scratch inside of us. And we fill that hole with so many things in life, but there's still this longing that I do. Yeah, I've gotten fame, and that's not quite it. I found success, and that's not quite it. I have all these things that society has told
Safe to assume this
I
is
should
regular
have
gas, right?
in order to feel.
It's not listed in the thing when you open it up on the cap.
No cap.
What color is the cap?
I
Oh, you
just
said
said
no
there's
cap?
no cap.
There's usually a sticker in there.
No, I know. It just says there's no cap.
I would assume it's regular gas.
What? I don't think it is.
It doesn't drive like a or sound like a diesel.
No, it's definitely not a diesel. However, it's got that little thing like it's got some yellow thing on the inside. Yeah. Okay, introduction to driving method. Hmm. See your oh shit, I knew that.
Oh, we didn't go do it somewhere over here, of course we did.
Can't get out to help get this. Hey, then get out and cut this shower lock off.
Child. Hey. I
So when they
need
get
my
out and do what?
Shower
I need my
lock.
slides.
Never mind, roll down the window. Hit the thing, roll down this window.
Oh.
Because yours isn't unlocked. Oh, maybe. Yeah, mine worked.
How do I put I I can't.
You gotta hit the button.
Oh.
Here. Here's inside.
Just need one. Some food.
What do you say?
What, you put in the wrong gas?
I don't know.
I don't really go to sleep. Like, so bad. Like, I'm in Delta, bro. Like, I'm in Delta. Boy, bro, I gotta go to bed. This time I've been sleeping. And then with a headphone on my head. Or you put in the wrong gas.
What?
I just start to work.
We have to, I guess we're going to McDonald's. Complete, satiated, and whole, and yet I don't. Oh, I thought there was more fast food
Is what the hero's journey is.
I got
about.
Isn't there that Chick-fil-A over there?
It's closed. It's
About
10 o'clock.
Doing something that
I feel like they got Taco
make you
Bell,
famous,
McDonald's.
make you money, or will bring you back.
Oh, Taco Bell is farther. I mean, Chick-fil-A is. There's one farther down the street though.
Maybe all of them will be closed at 10
the
o'clock.
empty
Oh,
void.
really?
It's going to fill the space in your soul so that you recognize yourself as part of something greater. There's a larger experience going on.
What?
And it's one reason that why most heroes' journeys involve the death of the ego, because we've got to die to something that just makes it about us. The hero's journey is never just about us. It's about something that we can transcend that's much larger than us.
So it's a sort of shift in psychology where the person comes back and maybe they haven't necessarily changed physically, but something, the way they look at life, place in always come out of that.
100%.
Right there.
When a hero comes back from the journey, they arrive in a land that in many ways they do not recognize. Even though it's the land that they left, even though it's home. It's where this idea comes from that you can never quite go home ever. Because it's not that home changes, it's that you change. And we, as people on a heroic quest, the whole point of going on the journey and going on the quest is to bring about something within us that is transformative. You know, in Lord of the Rings, when Bilbo Baggins is his
Jimmy
first approach
Jones.
about going on this journey, this quest. He said, I really love to know, but I don't know, we might be back in time for supper. I don't want the supper. I love that because
Maybe they're
it's
farther
such a
down.
common experience.
I thought it was. I guess I thought it was in this area. Though. I mean, at the end of this street, though, you got.
If the hero's journey is
I don't know if that stuff
the
is
hero's
open now.
journey is an experience that pushes us out of and there's a certain
back there.
of that call to adventure that must happen.
Masogi is a modern interpretation of the hero's journey.
Do you see a Taco
One you
Bell?
can do in a single
On the map,
and
it's
be changed by forever.
3 miles away.
By getting to your edge, you find that you don't fall off of it. That edge expands, changing you forever. You leave your old, limited self out on that edge. A Masogi is a psychological, spiritual, and emotional challenge masquerading as a physical one. The physical is just a path to the psychological. It is,
No,
of
Wendy's
course,
here?
uncomfortable.
I don't
Trials
even
and
remember.
challenges that
Do
we
you remember
have
a
to
Wendy's
deal
at the end of the
with
street?
obstacles.
And
They're
Chick-fil-A?
catalysts for change. Without them, we don't grow.
The hero may say, I don't have a choice. I have to go and do this.
Bruce.
No.
What can I get started for you?
Just a second, please. What do y'all want?
Can I get a double quarter pounder with just meat and cheese with fries and a Brave slushy?
Double for green cheese, fries, and a what?
Large Brave slushy.
What slushy?
Brave.
Brave.
What do you want?
I'll pass.
You not gonna eat anything? What do you want?
I'll do 10-piece nugget with fries and a braised thing.
Okay. Can I get the number 3 combo meal with just meat and cheese on the burger? With the Brave slushy. Yeah, then I'll do a 10-piece nugget meal with the Brave slushy, sweet and sour sauce. And let me do a
You're gonna have some of my fries and
bacon.
Are you
Let me
good?
do the
Okay.
2B with I guess mustard, mayonnaise, cheese, and bacon only. With a Coke for the drink, please. With no ice. And then the McCrispy strips. What if I just got the strips alone? What do they come in? What quantities? I can't see it. They do it 3 strip. Buffalo. That'll be it. All right, thanks. Oh, you're fine. Thank you. Separate bags.
I'll separate.
So I asked for no ice, but I do pass.
Or something like that. I ate like 2 little pieces of chicken, 3 little pieces of chicken.
What?
I don't feel like it.
I can get 2 bags and some salt, please. Yeah. For sure. Or what they've become comfortable with may not be there for them anymore. In Star Wars, Luke Skywalker, he returns back home and says, I got to get back home and work on the farm. And he gets back home to work on the farm, and it's all been burned to pieces. It's not there anymore. He has no choice but to go on the adventure because everything they had been comfortable has been taken. And I believe these are symbols, these are metaphors, these are motifs that mirror what happens in our own psychology. We oftentimes we are reluctant to step out into what we know we should be doing. And sometimes it takes the universe pulling the carpet out from underneath us and removing every crutch that we've used previously in order to set us a sail and embark out on this call to adventure that we know is going to bring about something amazing within us, but we don't know the cost. And that's scary. Yeah, that's frightening.
Absolutely.
I'm so sorry. I
Something
thought
we can all relate to. Life often presents us with a choice. Stay in the familiar or step into the unknown. And it's tempting to stay where we feel safe. But as John points out, real growth only happens when we choose the harder path. And this really, to me, is what's at the core in the heart of Campbell's Hero's journey is our relationship with possibility. We've seen it in history, we've seen it in myth, and we've seen it in our own lives. When we shut down our relationship with possibility, we enter this place that C.S. Eliot talked about called the wasteland.
And the wasteland is a powerful metaphor. And the wasteland, the metaphor dates back all the way to these Arthurian legends that I was talking about a bit ago. This wasteland is such a powerful metaphor because we see it in our world, we see it in our own country and our culture, but most importantly, we see it in our own lives. There's parts of our own experience, our own journey, our own psyche where things have just gotten stale. There's a debt that we can't seem to overcome. And yet there's a hope within us that somehow something heroic might rise up and be able to heal the world. I think the wasteland manifests in our lives in a number of different ways. One of the most common ways that we can see the wasteland begin to manifest itself in someone's life is through apathy. Apathy is one of the most common experiences of the wasteland. We don't find ourselves motivated by anything. We don't find a joy in anything. And the trade-off there is we don't find pain. And some of us feel like that's a acceptable thing. I'm willing to not experience the highs of joy as long as I don't have to experience the depths of pain. Joseph Campbell once said he didn't believe people were so much interested in the meaning of life as much as they were the rapturous experience of being alive. And can I tell you, the rapturous experience of being alive involves the heights of joy and the depths of pain. We need all of it for the experience.
I told John about Marcus Elliot's ideas and asked him if he thinks an attack like Misogi is a good way to get the boom of the hero strength. Here's what he said.
He's on to something there that is quite connected to the psychological experiences that we would have as human beings as far back as even going and searching for food or hunting for food. And we still have these needs, these cravings, these wants, these desires that push us out into these boundaries, which are going to have this unknown element to it. And I think our being drawn the unknown is one of the things that actually encourages me a great deal about human beings, because there seems to be this innate force inside of us that whispers to us and says, you know, maybe capable of much more than you ever imagined. But in order to find out, you're going to go to those boundaries. And that's often the time when the ground underneath us begins to fall from beneath our feet. And when it does, we have to ask ourselves, what have I done in preparation in my own character to respond in moments of the unexpected? What have I done to build something inside of me where my muscle memory, my innate reaction is just to respond in the way that I want to be known for responding? You know, another way that I sometimes think about this is with the hero's journey, we often consider ourselves to be in a certain place. We find ourselves in. I would suggest that most of us rarely know exactly where we're in this journey. We usually look back and sometimes I felt like I was a kid of this heroic journey, but I was actually just experiencing. In other times, I felt like I'm just being called out of this adventure.
the curve themselves of this big video. And there's certain things that what makes us him it did still be tall. So that finders back on the that make it really hard. Let's explore a fun immediate break. That's the percentage of time the average person spends in the immediate reaction is we hear that and think, ah, that's a lot. But is it? Or is it not? Let's put the pressure on that. Let's pick it apart and try to make sense of it and what we can make sense. On one hand, it makes a whole hell of a lot of sense that we spend so much time indoors. And indoors are safer. They're climate control. They're predictable. They are refrigerators filled with food, water on top, stuff that looks nice on our shelves, screens to entertain us when we're bored, screens we can use for work to get a stable income, and buy stuff that looks nice on our shelves. This is why, as we progress in society,
Professor,
for comfort, we've shifted more of our time indoors.
Professor,
Because of the parent kids
can you
today,
hear me?
one generation, or about 20 years previous, spend 50% more of their time outdoors than their kids do.
Professor,
So, given the increase in comforts, it's rather logical that we spend more and more time indoors to enjoy it. But is this in our overall best interest in the grand scheme of our lives? The spending more than reflecting lead us to squeeze the most out.
okay. Thank you.